The reason you probably got on this this webinar is because just last week, was it last week or the week before, the California Department of Public Health issued a public health order mandating that people who serve people with developmental disabilities through regional centers and through service providers are mandated to get the vaccine and have had the second dose of a 2-dose vaccine or the first dose of a 1-dose vaccine by November 30th. We're going to get into all the details of who is that for, who is that not for, with our speakers today. But to sort of set us off, we're gonna ask Tim Jin to really give us a little bit of background of why this mandate came into effect. Go ahead, Tim.
Hello, this is a great day for all of us to celebrate. I have literally been the face and foot of vaccines for people with developmental disabilities and their staff. I've been in magazines, newspapers, many TV news shows, and most exciting for me, National Public Radio. In January, workers who support people with developmental disabilities and IHSS workers were given early access to the vaccine. That was amazing, but it didn't make a lot of sense to vaccinate those folks and not vaccinate the people who actually have disabilities. As you have probably heard, people with disabilities are way more likely to get hospitalized and die from COVID. But people with disabilities had been prioritized and we just had to wait a little longer. Then in February, I learned that people with disabilities had been thrown off the priority list for vaccines by the governor. I was pretty pissed, so I wrote an op-ed in the Los Angeles Times asking Governor Newsom to make us a priority again. He felt the pressure, and we were back on the list for March 15th. This was a great success for our community and we all celebrated. I have advocated to make sure that people with disabilities can get access to the vaccine. Vaccine clinics need to be accessible. We needed to make sure that some people with disabilities who are homebound or have a difficult time in crowds can get their vaccine at home. Regional centers, counties, and many organizations started holding vaccine clinics at community centers, churches, and at people's homes. Another success that got a great many of us vaccinated. Finally, after living in fear and not leaving our homes for over a year, we started joining society again. We got to see our family and friends again. It was wonderful. Then the summer surge came and we realized that, even though the vaccine was available to every adult, a whole bunch of staff who support us were refusing to get vaccinated. We started hearing stories of people with disabilities contracting COVID from their staff. We heard that COVID was once again spreading in group homes. After all of our hard work, and now we had to live in fear again. California had put in a vaccine mandate for certain congregate settings like nursing homes. But that covers only about 10% of regional center clients. It didn't even cover people living in group homes. What about the rest of us? This is personal for me. I have about 6 staff coming in and out of my house each week. I have asked all of my staff to get vaccinated, and all but one has. But that one staff, who is very helpful to me, is just refusing to get the shot. That's when I started to advocate for a vaccine mandate for all staff supporting people with developmental disabilities. I didn't see the difference between staff that support someone in a nursing home and the staff supporting me. I don't want unvaccinated staff helping me with my daily needs. It's kind of hard to social distance from someone brushing your teeth. And once again, our voices were heard. The Department of Public Health issued a public health order saying that all the people who support us, from our supported living staff to IHSS workers to our regional center service coordinator, all must be vaccinated. This is another great victory for our community, and we should see it that way. We shouldn't see it as another burden or government intervention in our lives. We should see it as a way to save lives of people like me. You better believe that this vaccine mandate will save lives. It will also help us leave our homes once again and not live in fear anymore. Isn't that why you are all here anyway? So that we can live our lives included in the community? So after the mandate came out 2 weeks ago, I went back to my unvaccinated staff and told her she had to get the shot by November 30th, or she'd have to leave her job. Sadly, at least so far, she is choosing to leave. But I am about to enter the self-determination program in 2 weeks and will be hiring my own staff instead of using an agency. And all of my staff will be vaccinated. Unfortunately, I still get many random staff who are unvaccinated from the agency. At this point, I don't remember who they are because I get a lot of random caregivers helping me every day. I don't think that the agency that I'm currently with and soon to be leaving is not taking this health order seriously. Just a few days ago, they finally sent out a memo that all of their employees need to be fully vaccinated by the deadline. They have over 500 people working for them. My 15 minutes of fame is finally over, and I am no longer the poster person for the vaccine. We finally did it. Making sure that our community is safe. Thank you.
Thank you. Thank you so much, Tim. That was really helpful to give us sort of a background, and thank you for your incredible advocacy and being you're getting your 15 minutes of fame. Somehow I think your 15 minutes isn't over. We still have lots of work to do. We're going to move on now to Pete Chervinka. Pete is the Chief of Data Analytics and Strategy for the Department of Developmental Services. This is not the agency that actually issued the public health order, but he is the guy at DDS who has been working on COVID and on vaccine issues since the beginning. And Pete, thank you for being here, number one, and thank you for all of your incredibly hard work.
Judy, thank you very much for the invitation to be here tonight. Thank you folks who are spending your time to attend tonight. And Judy, I know you have a team with you as well, so thanks to them for making it possible. And obviously I don't know everything, so the panelists here are incredibly valuable, as you'll see as we go along. So I want to thank them as well for joining the conversation. I'm honored to follow Tim. I think he very eloquently spoke to why vaccination is really important for people. There's a lot of science now behind it. Totally understand in April of 2020 why somebody might not have wanted to be among the first to get a vaccine that's new. But we now have 150 million doses administered across the country. And it's proven now that it's very effective in at least alleviating the worst outcomes for people, including hospitalization and death. Nationwide, we're now currently seeing 95% of hospitalizations are unvaccinated people, and 99% of deaths are unvaccinated people as well. So it is highly effective. That's not to say it's not without side effects. I was down and out myself after my second shot for a full day, but it's still better than the consequences that I described. And it's not just about what we do for ourselves, but also what we expose others to. So really important that people be vaccinated. I appreciate the comment. I am not the person and I don't represent a department that issued the mandate. But we certainly are equipped to describe the state public health order issued by the California Department of Public Health and its director, Thomas Aragon. And it lays out very, very clearly. I can just kind of walk through it at a high level. We still are just barely above 70% in California in terms of full vaccination rates. The public health order lays out the case that I just described, that rates of transmission are higher among unvaccinated people and the health consequences are significant, and particularly in settings where people are together in adult and senior care facilities and group home settings where people are together, the rate of transmission is much higher. You have more people coming in and out oftentimes, and more interaction. One person coming in to provide services could very well interact with 6 or 7 people, which is a different dynamic than you would have going into a private home, for example. And so exactly what we saw during 2020 occurred. Those were the places and the settings where the highest rates of COVID transmission were. And unfortunately, also the most vulnerable people were residing. And this was a reason that in 2021, in late December of 2020, and then in 2021, in January and February, the federal government made a big push through the Federal Pharmacy Partnership Program to get vaccinations into adult and senior care facilities to the most vulnerable residents where this congregate care was occurring. And of course, they made big strides in the distribution, the allocation and distribution of vaccines for everybody else. And you heard Tim describe March 15 became an eligibility date for a large portion of our population, followed in April and then May, with more and more folks being eligible for vaccination. And so for those reasons, both being proven effective and because of the work that's being done, the public health officer in September, on the 28th of September, just a couple weeks ago, issued a vaccination mandate. And it requires that the first dose of a 1-dose regimen or a second dose of a 2-dose regimen has to be received by November 30 of this year by all of the following individuals. And the order, you'll forgive me for reading it because I think it goes later to some of the questions that we've been asked to answer. The first there's 5 groups of people named in the order. And the first is all workers who provide services or work in adult and senior care facilities licensed by the California Department of Social Services. So those are community care settings. They're largely non-medical facilities, if you will. So you can think about it, say, as assisted living or an ICFDD. The second group is all in-home direct care service workers, including registered home care aides and certified home health aides, except for those workers who provide services only to a recipient with whom they live or who are a family member of the recipient for whom they provide services. And I'll talk a little bit more about that exception in just a minute. The third group was all waiver personal care services providers as defined by the Department of Healthcare Services, and all in-home supportive services providers as defined by the Department of Social Services. Again, except for those workers who provide services to a recipient with whom they live or who are a family member of the recipient for whom they provide services. So if you're living in or you're a family member, you can be exempt from this mandate. The fourth category is all hospice workers providing services in the home or in a licensed facility. And the fifth category is all regional center employees as well as service provider workers who provide services to a consumer through the network of regional centers serving individuals with developmental and intellectual disabilities. Again, except for those workers who only provide services to a recipient with whom they live, or who are a family member of the recipient for whom they provide services. So an important comment about that last exception, which you heard me say 3 times. If you live with somebody or you're their family member and you're their provider, you are exempt from the mandate. To do that, however, you have to be providing services only to a single household. So if you provide services to multiple households, then you can't claim that exception as a family member or a live-in provider, because you will be in multiple places and thus more prone to spreading COVID-19. In the order, it defines workers, and there's a really long list. I can provide the link to Ed perhaps, and she can put it in the chat for us later when I'm done talking. It also defines employer, and it defines what they call a new term called employer recipient, which is the person receiving services from an IHSS worker, a WPCS worker, and an independently registered home care aide. And the reason for that definition is because there's a record keeping associated with the mandate. So you're going, the employer, or in some cases, the recipient of services, is going to be retaining a record of the vaccination. But more importantly, there are 2 other things about the mandate that provide potential exceptions. And this addresses some of the questions we were asked to respond to today as well. The first is for a qualified medical reason. For example, if you have an allergy to one of the ingredients in the vaccine, or you have a condition that would make even the adverse reaction for a few days of getting the vaccine dangerous for you, basically this would be something that you would discuss with your doctor and say, my body can't do this. There are reasons for that. I have an exception on a medical basis. And your doctor would have to document that with a statement as to the fact, not to your underlying diagnosis. So you basically need a doctor's note to obtain a qualified medical exemption request. And the other exemption provided for in the order is for religious beliefs. And that term is not defined. Many people in the United States and in California, a resident may have a religious belief that for whatever reason prevents them from becoming vaccinated, presumably not just from COVID, but other vaccines as well. And those requests for exemption would be processed just like any other employer request for a religious exemption to something. Virtually all employers in California are required to have policies for that. And it's recommended that those policies be followed to obtain the religious exemption. And I want to make sure I don't miss anything else. A record of those exemptions has to be kept either by the employer or by the employer recipient. And we recommend that the employee seeking that exemption maintain a record of it as well. And then the order goes one step further, and if an exemption applies, either the live-in exemption or the family member or the qualified medical reason or a religious belief, then the unvaccinated worker must, before entering or working in a facility or home, test for COVID-19 using a valid test that's been approved. And that test has to occur once a week for such workers. And they also have to wear at least a surgical mask or higher level respirators like an N95 face piece at all times while in the facility or in the home. And so that is kind of get vaccinated, but if you have an exemption, then you have to be subject to weekly testing for that. And then there's some standard language at the bottom of the order that, you know, kind of says local jurisdictions may have stricter rules. Those things apply. We're not contradicting anything previously issued. So it's a little bit of a long order, but it's very clear as you read through it who it applies to and how it applies. For the Department of Developmental Services, where I work and I'm representing today, that same day, September 28, we issued a directive to regional centers. We asked them to make that public health order and the directive available on their websites, and we asked them to inform their the vendor or provider community that they work with of the existence of the order. Our department, we're not a workplace regulator, so we're not enforcing it. We're not conducting surprise inspections and those kinds of things. Public health orders are generally enforced by either local law enforcement or in a facility setting by its licensing agency, like either the State Department of Public Health or the California Department of Social Services, depending on the type of facility. Cal OSHA potentially may have a rule. In some facilities, they're subject to stricter workplace rules for transmission, and Cal OSHA, the Occupational Safety and Health Administration, has jurisdiction for those. So who can enforce the mandate varies a little bit depending on where you are and where you reside. But this department absolutely supports the protection of the health and well-being of both the people we serve, but also the workforce itself. And we're happy to support the administration in the promulgation of the public health order. Judy, I'm going to hand it back to you unless there's more you'd like me to talk through.
No, that was great. There's been some questions, but we're going to wait. Wanted to let everybody know who's watching that the way we're going to handle questions is our preference is for you to ask it in the Q&A, which you'll find at the bottom. It says Q&A, very easy. In the chat, I would actually, because it moves so quickly, I would prefer that you just ask questions related to sort of the functioning of this webinar, like I can't hear you kind of things or things like that. Okay. So I see that a number of people have had your hands raised. We will not be calling on anybody to speak because this is a webinar format. So now we're going to turn to a real life doctor, because here at DVU, we believe in science and doctors. Lavisa Bhatti is an infectious disease specialist. So this is her deal. This area is what she does every day. But she also has a specialty in supporting patients with developmental disabilities and is a physician at the Achievable Clinic here in Los Angeles, where I live, which is an amazing clinic that really specializes in developmental disabilities. And I've asked Lavisa to talk a bit about the advice that she's going to be giving to regional centers and to service providers about how to talk to sort of vaccine hesitant staff about getting the vaccine. You are muted right now, Lavisa, so go ahead and unmute. Go ahead. You need here. I'm trying to get you to unmute. Are you having a problem? Oh, she needs to put on her glasses. Could you go ahead and pin her, Ed, please?
Can you hear me now?
Yes, now I can hear you.
Okay, perfect.
Fabulous.
I just needed the glasses. So thank you so much, Judy. It's such a pleasure to talk. And I think that I loved the presentation that Tim gave, because he really brought home the point that it's so very important to have people who have disabilities get vaccine and all the supporting staff around them get vaccine. I think a couple of points I wanted to make was that no viral disease has ever been controlled without a vaccine. We look at measles and polio and smallpox. and we see that diseases that aren't controlled, like HIV and hepatitis C, are the ones that they don't have vaccine. So we have an amazing vaccine for COVID-19. One of the points I wanted to say here was that in my practice too, I have seen that the most vulnerable are our patients because of multiple reasons. The inability to use a lot of respiratory function if they're not able to move as much. And the other thing also is that it's the masking issue, which some patients just cannot keep masks on, which is a significant issue. And also the fact that they are vulnerable. Remember that the vaccines are very preventative, they are very good, but you can still get infected again. And there have been deaths that have been associated with people getting infections even after they've been vaccinated. And that makes our population very vulnerable, and that's a huge concern. So for the people that have hesitancy in terms of getting the vaccine, first of all, it's really important to understand that this virus is not going anywhere. I'm just going to kind of recount a little bit of what my patients say and what people say. So it kind of brings to real life what people's thoughts are. So the first point I've been hearing a lot is that cases are coming down and this is going to go away and we don't have to expose ourselves to a vaccine we don't understand very well. This virus is going to become endemic. It is going to be back and forth through for the next few years. And we will see the surges that we have seen happen. And so it's really important to be vaccinated with this. The other point that goes on and on is that this is a new technology and we don't know what we are putting into our body. So the important point here to remember is that this technology has been worked on for more than 2 decades. The fact that they were able to pick up and run with it so quickly and make a vaccine was really the reason that there had been so much background work done on it. Albeit for another purpose, but still the technology was also there. Now, if you have a problem with this technology, the J&J vaccine is there for you. It has an old platform that has been used for multiple vaccinations, the live virus platform, the dead virus platform, all of those are very well known, very well used, and very well experienced things. So just the fact, if you don't want an RNA vaccine, that's fine. You have an alternative that's available to you. So that's an important point to get across. The other thing really is that at this point, aside from the US, in the whole world, about 5 billion people have received this vaccine. Now, I personally don't know of maybe very, very few cases that I can count on my fingers, but I don't know of significant number of deaths that have happened in people who have had the vaccine. I personally know of many deaths that have happened because of the COVID virus infection. That's something that people need to be aware of, that this is a very, very deadly virus. And as time is going by, it's learning its own techniques and it's getting. Just look at what the Delta virus is doing. So we know that it has now learned how to be much more efficiently transmitted and much more deadly than when we started out. So that's a really important concept. And for the people that come and tell me that I would rather get the infection than get the vaccine, so I always tell them that I want you to come with me and see some patients who have long COVID symptoms, because that is a reality too. If you get the infection, it's not like a flu that you're going to get it and you'll be better tomorrow. Well, the concern here is that the long COVID symptoms can persist for, I know people right now that have these long COVID symptoms for more than a year. They get short of breath, having 2 morsels of food. Walking anywhere, they're fatigued. They cannot concentrate because the brain is in some kind of a fog that just seems to be enveloped in this cloud around it that's not functioning. And I think the point that I say to a lot of my patients, I am interestingly seeing even in my patients a lot of hesitancy. And I always tell them that this is a collective responsibility. If you're coming into the clinic and you're expecting me to be within like a foot of you and examine your eyes, your face, your mouth, it's your responsibility to make sure that you protect everybody around you that comes close to you, as well as protect yourself. So those, I mean, it seems to be making sense. I don't really know what else one can say, but it does seem to make an impact, especially for people that are around anybody else that they can infect. And also, the point really is that one can be asymptomatic and still a carrier, and the Delta virus is way more contagious, has a much higher viral load than the virus that we started out with. So the likelihood of you being a carrier to asymptomatically carry to someone and cause their death is a very real possibility. And that's the main things that I can come up with. Now, in terms of medical exemptions, I did want to also say that I've had patients come and say, I have an allergic reaction to poison ivy, and I have a severe allergy to something else. But the point really is that you're having allergies to other things doesn't really make it a certainty that you're going to have an allergic reaction to this virus, to the vaccine. I would like to have those people be in a clinic setting and get the vaccine. Most allergic reactions happen very quickly. It's to a specific component in a specific vaccine. It's not in all three of them. It's only in one of them that we've seen more anaphylactic reactions. Those are easily manageable. Now we understand that very well. So that's not a valid point. And that's something, the reason I brought it up was because that is the point that a lot of people raise, and that's a concern that they have. There was something that I heard one of my colleagues say in infectious disease, and I kind of really liked it, because he said that the way that the Delta virus is behaving, unless you're living on top of Everest all alone with no chance of ever seeing anybody, another human beings, it is going to find you. So don't presume that you are safe in any way, regardless of what you do, it is going to reach you. So you have to protect yourself. That is a statement that actually has helped me. So I'm passing that statement on to a lot of folks that have any hesitancy. So
Thank you so much, Lavisa, Dr. Bhatti. So we're going to pause for a minute, and I'm going to ask a few questions to Dr. Bhatti, because she is not able to stay on the webinar for the entire time. So there's been a few questions in the chat that I wanted to send to you that I'm sure you've heard about these questions before. If you have had COVID, are your antibodies as good as if you have had the vaccine?
So not really, because when you the kind of virus that, first of all, vaccines are specifically made to produce a very robust immune response. So that is the reason we make vaccines, so that we prime the immune system to the best of its ability. When you have an infection with the virus, you have some immunity for sure, but you do not have the kind of immunity that you get with the vaccine. That is why the recommendation still is that if you've had COVID, you should go ahead and get the vaccine, because your immune response will be much better and much stronger than what the body generates on its own.
Thank you. Somebody's asking, what about myocarditis and pericarditis that happens after vaccination? I've heard of that happening because of getting COVID, but does that actually happen in vaccinations?
So yes, so there's nothing that has no risk at all. So myocarditis has been associated with the vaccines. It is associated a little more with the Moderna vaccine. And the reason for that is that the Moderna dose is much higher than the dose of the RNA part that you get. If you get 30 micrograms, I'm just taking this number off my head, like 30 micrograms in Pfizer, it would be about 100 micrograms in Moderna. So Moderna is a much stronger, has much more RNA in it. So the myocarditis is a possibility. Remember that even with the flu vaccine, we have cases of Guillain-Barré syndrome. We have different issues that happen with that vaccine. So that is a concern, but not a major concern. And the other issue really is that I am not aware of any long-term consequences of the myocarditis. Myocarditis is an inflammation and it does go away. So we know it, we understand it, we look for it, and there is no long-term consequences with it as far as we know, but you can always choose another of the vaccines if that's a major concern for you.
Thank you. Somebody, and this is just the last question. Somebody was asking, is the J&J vaccine a live vaccine?
No, it's not a live vaccine. So it's an altered vaccine. It's not something that can give you the disease. So it's an adenovirus that is that can infect human beings, but it's been changed in a way that it's not able to infect you anymore.
Thank you. I just want to say I do have one quick question that several people have asked about boosters for themselves, but I just want to tell folks that we're not going to sort of tolerate in the chat misinformation, and because we want this to be completely based on what science is telling us. And so if we are seeing things in the chat consistently from one of the attendees who is putting in misinformation, we may have to have you leave this webinar. So please, this is your warning. I will not give it again. So please keep to the facts. So just the last thing, a lot of people with disabilities and their families are asking, should we get the booster? Are we eligible for the booster?
So I like the idea of the booster, and I'll give you a very quick example. So I do this in my clinic very frequently. For example, a lot of people with disabilities are more prone, multiple reasons, for example, of getting like hepatitis A, and maybe not so much, but hepatitis B. Now we get those vaccines. This is a part of our regular vaccine schedule. But a lot of times when I check the antibodies are absent, or they are very low. So in that case, the system is already primed. It has seen the antigen, so it can mount an immune response. In that case, I use a booster. And what does the booster do? It basically revs up the memory of the cells that knew how to produce antibodies, and now they are better at it again. So the booster vaccines do lose efficacy over a period of time. These are new vaccines, new disease for us. So we're learning that as time passes by, the efficacy decreases. We hope that it doesn't decrease to a point where it is ineffective, but it seems that it is holding itself well. But people that are at high risk, I am advising my patients to get boosters because I want them to be protected, and I want them to have enough immunity in case they get the disease. So I am recommending it for my patients that have risk factors, that I am afraid that they are not going to wear a mask, or they are unable to wear a mask, or they have other significant issues in terms of disease that makes them more vulnerable. I think a booster is a good idea.
Thank you so much, Dr. Bhatti. Stay for as long as you can. We understand you have another meeting to get to. Thanks for being here. We have 3 more presenters, but I just want, this question's come up a couple of times in Q&A, Pete, and I just want clarification from you. Are consumers required to get vaccinated, or is it just the staff?
The requirement applies only to those described in the order. Consumers, it does not apply to. I will make a small caveat because it's come up in other conversations. If a consumer is employed and is providing services, they could be subject to the mandate because they are providing services and they meet the definition of the worker. That's not a large percentage of our population, but I don't want to say 100% consumers don't have to be. If they're working and providing services, the mandate appears to apply.
And I'll just say, this is my opinion, the consumer should get vaccinated. Like that is
Yes.
that is a priority. And it's been a priority for Tim and for Disability Voices United since the beginning. We fought hard to get in the priority list. And if you're a consumer out there and you have not gotten vaccinated, you know, please, please, please do it.
We second that. The question was, is it required? It's
Right.
not required. It's
Exactly.
strongly, and then strongly again encouraged. Yeah.
Thank you. Thank you. All right. I have 20 more questions for you, Pete, but I'm gonna move on to our other speakers because some of them can answer them as well. Our next presenter is Amy Wessling. Amy is the Executive Director of the Association of Regional Center Agencies, or ARCA, meaning all the 21 regional centers in the state have an association, and she's the head of it. And I wanted to invite Amy to talk a little bit about what ARCA is doing and how you're getting information out there.
Yeah, thanks so much, Judy, and thanks to everyone for participating this evening. And really want to express my appreciation for Tim for really level setting for us tonight. You know, I think that when we think about how do we encourage people to get vaccinated, it's people like Tim and his advocacy that really highlight that at the end of the day, we're all here to support people who are served by regional centers and to do everything we can to keep them safe and healthy. And part of that includes this vaccination mandate. So when we think about regional center staff and the public health order that was released, as Pete noted, it requires all regional center staff to be vaccinated by November 30th. And regional centers are in a little bit of a different position by and large than many service providers, in part because many had, or a few of them had gone down the path of a mandate ahead of the public health order. And most are seeing staff vaccination rates over 70% already. So they had been sharing with one another kind of how that was going, what strategies they found most effective. And ultimately, it came down to the strategies that were most effective were reminding people that really the best way to get back to doing the work that we're all here for, which is seeing people in person and getting that community interaction with the people they support, is to get vaccinated. And so regional centers that are a little further ahead in the mandate have seen, I think, consistent with other industries, very low numbers of staff that ultimately decide not to get vaccinated and to leave their employment. So very, very low percentages of staff are making that choice. Additionally, they're seeing, for the most part, low percentages of staff claiming either a medical or religious exemption as well. So, you know, when we think about how is this going to play out through the rest of the regional centers, we do have, you know, kind of that foundation of experience based on the few that were quick out of the gate with a mandate in the last few months. And really, our attention is starting to pivot to how to best support service providers in terms of getting information pushed out to not only the providers themselves, but also their staff. Because, you know, one of the things that we're concerned about is how to ensure, as Tim said, you know, he has a staff that if he were to stay with his current agency, would opt not to, or at least the impression is, would opt not to receive the vaccine and would create a hole in his schedule. So we're really spending a lot of time and energy interfacing with service provider organizations, and certainly Erin will talk a little bit later about the local work they're doing, but with individual service providers about how to ensure that we don't have gaps in care in approaching and trying to arrive at vaccination levels that will keep people safe. So that's really where our energy is being spent right now. In terms of the public health order, the thing that always excites me is, and I recognize this may sound a little nerdy, is when the questions that I start seeing are nuanced and very narrow, because that means for the most part, people understand what the public health order means, they understand who it applies to, and they're getting down to the business of implementation. And really that's what I'm seeing a lot of within the regional centers, is a lot of conversation about more narrow situations and broader outreach to the greater community about, you know, the mandate and how we get from point A to point B. As Tim noted, you know, regional centers have been doing vaccine clinics, or they started those very early, and providing their communities with information about where to get vaccines. And we're beyond excited that now we're in a space where supply is not the issue. It's really addressing people's remaining concerns, and, you know, doing that through other staff and doing it through trusted community members. DDS has some great resources on its website that are both government and non-government resources. And so directing people to those things to alleviate any ongoing concerns. So really appreciate the opportunity to be here and talk through some of the things that we're doing, but mostly just to express how excited we are to be working and pursuing this journey with everyone.
Thank you, Amy. That was great. And thanks for being like an ally on this. It's really been, the regional centers have been amazingly heroic by getting these vaccine clinics up and going and figuring things out. Our next speaker, speaking of a heroic person at a regional center, we've invited Erin Olson, who's the Assistant Director for Community Services. It's at Central Valley Regional Center in Fresno. And if anybody actually looks at the map and data in California, like I obsessively do, you will see that he is right at the center of where there is a great deal of vaccine hesitancy, and where, not coincidentally, but causally, there are many, many people in hospitals and many, many people dying, many more people dying in the Central Valley than in other parts of the state where there's higher levels of vaccination. So Erin, tell us how it's going for you and what your goals are going to be to get this information out there.
Well, thank you, Judy, and thank you, Disability Voices United, for letting us participate today. Central Valley started, in March after Tim's valiant efforts on trying to engage a population that we obviously were very concerned about needing the vaccine or going through the process. Started working with our community partners, local public health authorities, to say, hey, we're here. We have a mechanism to support the process. And they were very receptive. And that was, I think, the first steps towards interagency collaboration within our county providers. And that really led us down the path of being able to support not only the individuals that we serve, but also their service providers. So initially, one of the areas that was presented was the caregiver towards an individual needing the vaccine. And some counties, which would privately contract their services, would require additional paperwork, which created an impasse for individuals that were providing services to get vaccinated. So one of the things we did is we said, hey, we'll be happy to sit at the front line and check people in and get that ball rolling for you. And because we knew who the service providers were and how their staff worked, we were able to quickly navigate those paperwork components that would require or allow the private entity that was doing the vaccinations, them to get paid. And so what we did is we took the information as we got it and helped modify the service so that we could get people through the door and get them there, get them vaccinated. And so that was one of the things that we tried to help at the beginning. As you know, as we all know, we went through that whole process. Our state was united in this process. We did a great job throughout the state to July. And then 4th of July hit and everybody was like, well, COVID's over. It's not really around anymore. Everybody's fine. And it was that lull. It was that one lull in June and July that because people were so tired of the pandemic we started to see the wane and the shift. And now, as you have mentioned, the Central Valley is kind of a hot zone right now. And a lot of that has to do with choice. And so the regional center's responsibility to the individuals that we serve is to ensure that they're in a safe environment and a healthy environment so that they can thrive and prosper. So we work with our vendors, our service coordinators, in getting information out, making sure that we have PPEs. A lot of the stuff that we do is we try to make sure that we're being proactive instead of reactive. And so one of the areas that our vendors have struggled with is they have so much information from so many different agencies that they're required to be compliant with that it becomes very confusing and very daunting. So you might have the California Public Health Authority issue a directive, but as you saw on the 28th, then all of a sudden, all the agencies that report under the Department of Social Services Community Care Licensing Division receive a provider information notice. And then the regional center system sends out, DDS sends out a directive, and everything starts to align, but there are previous requirements that are also attached to those licensed care providers, like testing their individuals as they're there every so often, once a week with a PCR test or 2 times a week with a preliminary emergency test. So there's all this information, and then there's the response testing that goes along with that, those requirements of those additional licensing oversights, and that becomes confusing to many providers, and I would probably say frustrating. And so one of the things that we have done as a regional center is we have an amazing team that is kind of like information central, basically the help desk. So, but instead of them calling us, we call them. And so we call them and say, how's your response testing going? Are you meeting the compliance of this component of requirement of 30-day testing? And many times they'll say, well, we didn't know that we were supposed to do. And so we help them go through that process. And then we provide supports on top of that, like remote testing agencies that will go out and provide the testing for them. So they're not having to pay for tests. We can have tests brought to them through local resources that are available to them. And they really appreciate that. And in ProPer, then they test more. And then in ProPer, then we get greater results. And so then we can start to really track to see how we're maintaining a healthy response. So when a staff member does test positive, we can support the agency and make sure that no one else is going, our staff, or we can notify the individuals that are being served that, hey, there's an outbreak. You might want to stay away for the CDC required time frame so that they can, make sure that the person's healthy, the system is safe. And so it's those types of proactive ways, at least what we have been doing at Central Valley, that we think helps at least our population. Even though we do all those things, we still see the numbers that we see, and that's based upon individuals making a choice to choose not to get vaccinated. And as Pete had mentioned and many other people had mentioned, it's the unvaccinated that are the ones that are impacting the medical services that are out there. And so to the best of our ability, we just continue to bring that information forward. And some of the other areas that we look at is we make discussions with our local partners to say, should we do more clinics? Are the clinics more comfortable for our population to come to the regional center instead of going to a CVS or a Walmart? We've had many, many families that say, I can't take my son who's on the spectrum into a CVS and have him wait for 20 minutes to get an injection, because it's just not part of it. His environment is so precarious that that type of stimuli would not work well for him. We really need to get moved in through a system that is very detailed towards the population that my child is involved with, and we cater to that population, and we see success that way. So we look to see, should we be doing those types of things, not only for the people that we serve that aren't vaccinated, but then is this an opportunity for their providers to again come back through the system, and because they're going to be doing caretaking at the time for an individual, we could also get them equally vaccinated. So those are some of the things that we try to do. For those agencies, one of the questions that was asked is, what if staff choose not to get vaccinated? Well, that's a really hard decision for an individual to make. You know, loss of employment because it's a contingent of their employment is a difficult decision to make. And we have to be respectful to that decision. And then we have to understand that there's going to be an impact. So when those impacts occur, it's the regional center's responsibility to be in compliance with case management and case oversight. So if a service coordinator makes a choice to resign because they're following their belief system or whatever it is that they've decided on, it's still our responsibility to serve those individuals underneath that caseload to the best of our ability. And we will be doing that. That is our goal. We talk about that regularly. How are we going to manage this? To Amy's point, however, it's a very small percentage that we think that are potentially those individuals that might make that choice. And so the impact to the system will not be profound. So we're holding that faith that is what's going to occur. And then we're going to strategically plan for both sides of that, either the best case scenario or the scenario where we really have to dig deep and provide support.
Thank you so much, Aaron. Really appreciate that. Our last speaker is Debbie Davis, and then we're going to I know I have a list of 25 questions that have come in. And we asked Debbie because, well, Debbie wears so many hats that she's kind of the perfect person to be presenting. She's a service provider, which is what we wanted, a person who actually is the direct care providing or runs an agency that provides direct care. But she also happens to be a registered nurse. She has a lot of initials after her name that I'm not even sure what they all stand for, but definitely I know that RN is a registered nurse. I know that you run an agency called Special Care Services and provide supports to some folks who have significant underlying health conditions, and wanted to know, I know you put in a vaccine mandate. You were so early on, and want to know how it worked for you and advice you might have for other service providers. Thanks for coming, Debbie.
Thanks for inviting me. And I've known for a few hours now that I was going to be speaking tonight, so my comments will be brief. But yes, I am a registered nurse. I'm also a nursing instructor at the local community college RN nursing program. So I'm keeping up on a lot of the research through that as well. And as an early adopter, we did put the vaccine mandate at my supported living services agency as of September 1st. So we're a small agency. I only have 80 employees, but we serve kind of the highest risk medically fragile individuals in their homes to prevent institutionalization or having to place them in facility type settings. So they are obviously at high risk if they get COVID. We did before this have a flu shot mandate already. So as a condition of hire, everyone needed to get their annual flu vaccine, which everyone was compliant with. So we kind of started with a population that was used to getting vaccines of some sort. So I think that helped. But out of the 80, we had 98 point something compliance. There was only one caregiver that did not want the vaccine. She didn't have a religious or medical exemption, but she just didn't want to get it yet. She was still not kind of unsure about it, which is her choice completely. And then from there on out, after September 1st, we it is now a condition of employment. So when we're doing recruiting and interviewing, that's one of the questions we ask before we consider hiring someone. So that part wasn't as hard as I thought it was going to be, but it did take a lot of education. And I think that's the point that direct line staff really need to know the facts. And they hear a lot of things, they have a lot of questions. Some of it might be true, some of it might be, conspiracy theories or just hearing things from other people. So it's really important to get the science and the direct information to them. And that's one thing that we did, both as groups in like group Zoom meetings and trainings, and also one-on-one. If people had questions, I just put it out there that, go ahead and contact me and we'll talk through it. And I think that helped a lot. I let them know in May of this year that the mandate would be September 1st. So they had 4 months to kind of process and think about it, which also helped. When the vaccine first came out, we had about 65% compliance. We held a vaccine clinic at our office in Northern California. We're in the North Bay Regional Center catchment area. And we had most of our employees get their first and second Moderna shots at that point. But we didn't require it until September 1st. So it's been successful. It's been hard. I think that the underlying goal, and Jackie Dillard-Foss, who was supposed to be presenting today, and I have talked about this a lot, is that in the end, we're here to protect, the consumers and the people we support who are at higher risk of getting very sick and or dying if they contract this virus. So that was my kind of, motivation for doing this, and it's worked out for us. I really appreciate that finally the public health order included people with disabilities and those who support them. And because before that, we really didn't have a lot of kind of clout or credibility to say, well, look, this agency is saying that, this is something that's important for our staff to prevent infection, both for staff and I would like to have some sort of statewide way of holding providers accountable, because I know that a lot of them are still not ready to make that mandate. And the support from the regional centers has been good. I think that having more education and more kind of support for testing for those that aren't going to get vaccinated. I didn't have to deal with that after the vaccines because we had everyone vaccinated. So now we're only testing if there's an exposure in the community or if someone is having symptoms. We'll do the testing right away in our office and we do the rapid testing. But other than that, I think that, holding providers accountable to make sure that they're complying with the public health order is going to be what's needed to get us to the next level and get us a little bit back to normal. So that's where we are. And it's a tough decision to mandate something when you know that staffing is already short and providers are, having trouble hiring to begin with. But we just both, Jackie and I decided to just take that leap and go for it because our goal was to protect everyone we serve. So that's my story.
Thank you so much. And you're our remaining healthcare professional since Dr. Bhatti had to leave. So I may have a follow-up question. I want to remind everybody that we're not, I see a hand up. We're not going to be taking people's questions verbally because we have, we're in a webinar format, but please go ahead and type your questions in the Q&A. That's what I've been following a lot. It's preferred to do that instead of the chat because the chat is moving constantly. Okay. All right. Tim Jin wanted to make a comment before we move on to some of the questions. Go ahead, Tim.
I have a question. Let's say a person gets an exemption not to get vaccinated. Who is responsible for paying the weekly COVID test? Is it up to the individual or to the employer to pay for the weekly COVID test? Such as regional center agencies, IHSS, and self-determination. By the way, I'm sure everyone on this panel and everyone in the audience really don't want to be tested every week for COVID-19. At least I don't.
Yeah, it hurts the nose. It's not that fun. I agree. So Pete, Amy, Aaron, if a person, so it's not that a person doesn't want to get the vaccine, it's that a person has a legitimate reason to not get the vaccine, but will have to get tested. Who pays for their testing?
I unmuted first, so I'll take it, Judy. The short answer is that compliance with all state public health orders is the responsibility of the employer, and the employer is required to pay. In the same way that, say, a worker in a restaurant is required to wear a hairnet over their hair at work, that kind of hairnet has to be supplied by the restaurant that employs them. In the same way that to control public health infections, like a nursing home might, when they're cleaning somebody, sponge bathing, the employer is providing the sponge, they're providing the gloves, they're providing the hazardous waste trash disposal. It's a employer responsibility to pay for the COVID test.
Thank you. So there's, I think a lot of these questions are going to come to you, Pete, but Amy or Aaron may be interested in.
Well, I can add a little bit to what Pete has mentioned. So that's for all employers. Now, the Department of Public Health or Department of Social Services Community Care Licensing Division issued a public health, a provider information notice called a PIN, P-I-N. And in their PIN, which was also aligned with the California Public Health Directive in August, they were very clear that not only should the individual not be penalized through their insurance, but neither should the provider. So the employer of the service provider, their insurance rates should not go up, or they should not be adjusted. And that's very clearly spelled out in that. So for the service providers on the call, one of the things is to do an inquiry with your workman's comp, which I know people are terrified about doing, but the PIN was really very direct in letting you know that no costs should be increased or adjusted, nor should there be any type of penalty for providing the test to your employees. So that was a very welcome thing for service providers, because they're always concerned about, in my workman's comp cases, is my workman's comp insurance going to go up because I'm having to do certain things to be in compliance, like the hairnet, example. It's like, that's a cost, and we don't want all of a sudden to spend, a lot of money on a specific thing. So that was one thing that for service providers was very clearly spelled out in those Department of Social Services Community Care Licensing Division provider information notices.
Great, thank you. And so still more questions on testing. So the only people who are allowed to test once a week are those who have a valid exemption. It's not like, oh, I've decided I don't want the vaccine, so can I just do testing once a week, right? It's only those with valid exemptions.
Correct.
Okay. Okay, what if a person is a staff member who serves in one household, but there are 3 different clients? Like, it sounds like maybe it's sort of a group home type situation. Is that person required to be vaccinated?
If they work nowhere else and they live in and they're providing services to a single household, then that works.
Okay. But only if they live in. Let's make that very clear.
That's correct, unless there's the additional, like mom caring for her 3 kids is
Right.
their IHSS provider. That's a family exemption.
Right.
So the situation matters for the answer to that. But the short answer is, if you are live-in or a family member providing services to one household, the exemption does not apply. The exemption does apply.
Does apply. Got it.
That's the correct way. Sorry.
So there's lots of questions where people are clearly concerned about those who choose not to get vaccinated. Like, so we're getting close to November 30th. You have people who've chosen not to get vaccinated. What's going to happen? Whose responsibility is it to speak to them about it? And then sort of as a follow-up question, which may be for Debbie or Aaron or Amy, what are we going to do to make sure that those individuals, if there's a hole in this, in their support staff, what are we going to do to make sure that those folks are not left in the lurch and they're cared for? So let's just start with who's responsible if somebody decides not to get vaccinated to tell them what's going to happen. Is that Pete? I'll have you say, is that the employer, Pete?
Yeah, the mandate applies to the employer. Their workforce needs to be, I mean, technically it applies to the employee. You know, I think I could give you a really long answer to this question, but I'd like to keep it short. What I guess I would say is ongoing regular communication with your employees is absolutely critical. Not because it's an expectation, you need to convince them they're wrong and kind of force them to do it against their will, as much as it is to offer them as much education as you can, but also for your own planning to know who is going to get vaccinated, who is not, who is likely to quit, how many people will need, if you have 500 employees, are you going to need to line up testing for 30 of them because they're planning to get a religious exemption? Do you need testing for 100 of them? You need to have that regular ongoing communication, not just to help them understand the impact their decision has on others, as well as themselves, but also for your own planning purposes. So I would say regular ongoing education is important, but the employer is the employer. You know?
And so maybe this is to the other panelists, what do we do about the fact that there's a huge shortage in staff, that a consumer or an individual with a disability is going to be left with a hole in their staffing?
And this is Amy. I managed to unmute first this time. And so I'm going to piggyback on what Pete said to the earlier question, which is the greater the level of communication, not just between the provider and their staff, but with the regional center, the greater the opportunity we have to help fill in some of those holes. So we don't want to get to November 30th and all of a sudden hear from people, oh no, you know, now I have all of these staffing vacancies that need to be filled. And so the more opportunity there is to communicate that proactively, the better off we're all going to be. In terms of, you know, I'll be honest, what keeps me awake about this process, and I really think it's a process where we will land in a good place. But what keeps me awake is concern about the very thing that Tim brought up. What happens if residential staff or if SLS staff, staff that people really rely on for health and safety, leave in relatively large numbers? And I think the earlier we know about that, the more we're able to be part of the solution. And it may depend on the situation. Does it look like doing some sort of rate adjustment to accommodate increased overtime? Does it look like helping to hook residential providers up with other providers who maybe can lend some staffing support? So the more quickly regional centers are aware of the situation, the more that they can help fill in those gaps. But there absolutely is a commitment to ensuring that as we move towards compliance with this, which is intended to preserve health and safety, that we don't jeopardize health and safety. So I think, as Aaron said, keeping in close contact with the providers, particularly those who provide a health and safety function, is really one of the things that regional centers are concentrating on right now.
Great. Pete, there's a question. Thank you, Amy. There's a question about who once again, who has to get vaccinated. So the question is just generally, does it apply to those who are only working remotely? Now, I know within regional centers, every single regional center staff member, regardless of what your position is and whether you work remotely or not, has to get vaccinated. But what about at a service provider agency?
Sure. I think it really hinges on the definition of what is a service. The public health order doesn't say who provides services in person. It says anyone who provides services funded through the regional center system. I'm paraphrasing, but that's basically what it says. You know, therapeutic services, speech therapy, things delivered, you know, those are probably services, and the order would apply. But I think, you know,
But what about the accounting staff of a service provider agency?
and I
never
think there's
talks to.
probably room for, that was where I was actually going with that, was, you know, technically the accounting person makes everything else that happens at the provider function, right? They're paying the bills, issuing the payroll, whatever it happens to be. Is that a service? It's indispensable, but I think it's a little bit of a question. If your accounting shop is, you know, working remotely, I think you could make an argument maybe they don't have to be. And I think you could make an argument that they should.
Yeah, I mean, I think that's an excellent point, because I've certainly in an in-person day program, you know, the accountant may be in an office down the hall and using the same bathroom as people with disabilities. So you have to use good judgment here, I would say.
Yeah, I mean, remember, the intent of the public health order is to make sure that people stay healthy and stay safe. And so that should be the framework in which everyone is making those decisions, right? It's not just about you and kind of the state imposing its vaccine mandate on you. They're doing it to try to protect the people that we're serving, to protect your coworkers, to protect your boss, to protect your family. Because, you know, walking down the street or through the grocery store, we never know who else might be immunocompromised, for example. So it is also about other people. That's the intent of the order as it's written. So a lot of those decisions should be made through that lens. Now, an individual provider, of course, is going to have workplace equity, right? This accountant is working remotely. This one is not. Does one of them have to be mandated and the other not? You might choose to say you're providing a service and do them both. You know? So I think it's again situational, but should be viewed through the lens of what are we trying to accomplish by doing this?
Thank you. This question's come up a couple of different times. Are service providers in the self-determination program covered under this mandate?
Again, I think the language of the order says service providers providing services funded through the regional center system. I think that's a clear yes.
Yeah.
Again, there are some exceptions. If you're a live-in, if you're a family member, if you have a religious exemption, those things, but the order definitely applies.
Yeah.
Including the exemptions.
And certainly we're the big organization that works on the self-determination program, and it is something that I certainly have mandated with in our household for the people who supported my son in self-determination. So one of the questions people have is, so if a person if the employer is the individual with the disability because it's an IHSS worker, or it's in support, or it's maybe a respite type thing. Oh no, it's probably participant directed services maybe, or maybe it is the self-determination program where the individual with the disability is the employer of record. What is your recommendation for people with disabilities and their families to try to ensure that that all the people who are supporting them have gotten vaccinated, because they're not traditional employers. They're not an agency with personnel policies and a human resources director. What is your suggestion on how we kind of handle it?
I feel like sometimes my answer to everything is communication, Judy, but I really think asking the question, are you vaccinated? If you're not vaccinated, do you need help? What do I need to do? The order is clear. People who are not vaccinated must wear face coverings, appropriate face coverings at all times in those situations. I really think it has to be that dialogue between, we can equip people with education, forums like yours are educating people about what's supposed to happen. And that's a big part of that conversation, and the ability to know what's expected and what the exceptions are.
Right. How specific and personal, and I'm not even sure if we have the right group of people who can answer this, but if somebody is asking for a religious exemption or a medical exemption, what kind of documentation are we as employers allowed to see?
So for religious, the order doesn't actually require documentation. It requires a signed declaration form. As I said earlier, and I'll repeat here, I think it's important for employers to follow their established policies. Vaccination is not the only religious issue that comes up in a workplace. Some people need prayer time throughout the day and those kinds of things. Whatever the process and the policy is that the employer has really ought to be followed. The order doesn't mandate something specific for that. For the qualified medical exemption, it's going to need to be a medical professionals. The order is specific about this, so I would encourage people not to take my paraphrasing of it. But it needs to be a signed statement by a medical professional that a medical thing exists, that vaccine is not recommended for you. I want to make one small point here. You can't ask what's your medical condition. Those kinds of things are HIPAA violations and medical privacy. We wouldn't tell somebody what's wrong with us, and we should not expect people serving us to have to disclose their personal medical info to us. But the signed medical professional note saying they're medically excused from it is enough.
Yeah, that was the thing I was going for, is that you're not going to find out a diagnosis or anything, but you do have to have something signed by a physician. So thank you for that. There's a lot of questions about testing, which I find to be curious because I'm not really sure if there's any data out there on the percentage of people who have valid medical and religious exemptions, but there's so many questions about testing that there is obviously some feeling out there that there will be a significant number of people who will be asking for these exemptions. I just want to point out our communication coordinator, Ed, reminded me today that the Pope said that the Catholic religion is not a religious exemption. I can tell you as a Jewish person, Judaism is also not one of the religions that provides an exemption. Everybody's asking, like, if you're an IHSS employer, do you have to pay for the testing? How, if you have an agency that has thousands of workers, how are you going to know about testing? I'm assuming the thousands of workers are not going to be getting the medical or religious exemption. Would we guess that it's going to be a tiny amount of people? What would we think? Debbie, anybody? Like, Debbie, what do you think as a healthcare professional? What percentage do you think have a legitimate medical issue?
So for medical, it's very few. What we see more of is the religious exemptions. However, like you said, there's very few religions that don't believe in vaccines. So, going through the interactive process, when you do get a request from an employee for any sort of exemption, no, you don't ask what their diagnosis is. If they have a valid medical exemption, then that's one thing, but the religious ones have to be a sincerely held religious belief. And it's, you know, it's really hard. You can't like question them to the point of deposition on it or anything, but you need to make sure that it didn't, you go in through the process to make sure that that exemption is valid. For us, it, you know, the interactive process also includes the fact that it is a huge health and safety risk to the consumers to have unvaccinated staff. So even though we would accept an exemption and review it with the employee and have that discussion, in the end, if they're going to be providing direct care, that would present too much of a health and safety risk, and they would need to be excluded from the workplace for us. But again, I don't know how the other providers are approaching this issue.
Thank you. That's helpful. Somebody was asking that they have a really valued staff member who has a religious exemption, and they are working with residents. Is your suggestion that this person who's not vaccinated be working in a home where everybody, all the residents are vaccinated? I'm not a doctor, but I would say the answer to that is clearly yes. But that individual, that staff member, that valued staff member needs to be wearing a surgical or N95 mask, and they need to be getting tested once a week. I can tell you this, that we have been hearing stories for the last several months of people, particularly unvaccinated consumers who are living in group homes dying of COVID or hospitalized from COVID. And remember that, you know, we are urging, and everybody keeps talking about, like, how do we mandate consumers to get vaccinated? I wish we could. That would certainly be something I would support. But how do we, yes, and Tim is saying the same thing. But in some of these cases, they're adults who are older adults living in group homes where maybe they don't have families who are involved in their lives and ensuring that they're getting vaccinated. So nobody kind of went and did it. I guess, so a lot of people are asking, what should we do? How are we, should we not allow services to unvaccinated clients? Pete, is there anything in the works, anybody advocating for at least consumers who are in congregate programs and settings? So that means those in group homes, those in nursing homes, and those in congregate day programs or work programs. Is there any conversation about potentially requiring them to get vaccinated at least?
If there's a conversation about that, I'm unaware of it.
Okay.
We generally don't require public citizens to do something like that. The mandate really applies in the situation where, in the course of your employment, something is important. And government does that all the time, from the hairnets that I mentioned previously to protect people to things like the vaccination mandate. We have mandates for public schools, you know, to attend after 7th grade, you need, you know, TB vaccine testing, and, you know, all those kinds of things that happen. So there are lots of situations in which vaccination is required, but it's as a condition of something that you're doing. I want to say, too, given the audience, consumers of regional center services cannot be denied service based on their vaccination status. So I want to make sure that I say that as well.
Thank you. That's really important to remember. Everybody keeps talking about who's going to pay for the test. I know we're running a little bit over. We have just a couple more questions, everybody. Who's going to pay for this testing of these people who are getting who are not required to get the vaccine? And I want to stress that I don't think this is a lot of people, because the people, remember, pregnant women, they're saying absolutely should get vaccinated. People with heart and lung transplants should desperately be getting vaccinated. I personally myself am a person with underlying health conditions and an autoimmune disease they're telling me to get the booster even. So it's really a very tiny group of people who cannot get the vaccine. And so anyway, they're asking about testing and who pays for it. I just want to make clear, because I'm obsessed with all these things, that there is free testing almost everywhere in the state of California. So I wouldn't be sort of focused on who pays for the testing. I can tell you I've had to get tested lots of times in the past year because I've traveled somewhere or I've been invited to some event where somebody said you have to get tested even though I'm vaccinated. And just your local pharmacies, CVS, Rite Aid, Walgreens are offering free tests. And then I know I live in LA County. Our county has free testing with less than 24-hour results at public locations around the city and the county. So all you have to do is Google free testing with your zip code or your county, and I can promise you, you'll find places that are available for free testing. I mean, there's also the kind you can purchase at the drugstore or online that provide that you can use. Some of them are quite expensive, and I would recommend that you just take advantage of these free sites that exist. So I'm just gonna ask one or two more questions, and I appreciate everybody hanging in there. So when employers are asking their staff to get vaccinated, many of them already are vaccinated, but we need to have some sort of proof of that. Are you asking them to produce, like, I don't know, Debbie, if you did this, or Aaron, you're going to do this at your regional center, are you asking them to actually produce their vaccination card to actually have real proof? Are you uploading it to some portal where you're keeping a copy of it? Or are you going to look at it once and then move on?
Look at it once and then move on. That, for us anyway. I'm not making copies or keeping it in a file, but we do need to see some sort of evidence of vaccination.
Okay, great.
Correct. The same thing for Central Valley. You have to present your card or go on and present the on your app. There's an app for your vaccination status. I do know that we're looking at it. I can't confirm whether we're storing that data or we're not. I just know that we are asking to see it. Our human resources department is managing that. So it's really nothing to do with anybody from a supervisory level. It's all handled through our HR department.
Great.
And this is Amy, just real quickly. What I've heard from regional centers is largely consistent with what Aaron said, and that because of concerns related to OSHA and all these other things, that staff who will not produce evidence of vaccination, because there are some who are vaccinated who will not show proof, that regional centers are handling them as if they are unvaccinated.
Interesting.
That is
Wow. Why would you not show proof? Okay, these things confuse me. They really confuse me. And just to make very clear, because I want to make sure this question is answered, that supported living services agencies are not specifically listed in the public health order, but they are definitely part of this mandate, right, Pete?
It's yes. Short answer is yes. They are absolutely covered by the mandate. They are funded through, they're a service funded through the regional center system. Absolutely, they're included in the mandate.
Okay, great.
Including the exemptions and all the rest. Yes.
Go ahead, Tim.
But we should not rely on free testing. As more and more people get vaccinated, the free testing will eventually go away. Maybe not in 6 months, but it will eventually go away. Just get vaccinated unless you have an underlying condition.
Thank you. Everybody listen to Tim. So I want to thank all of our speakers and give them one last chance to, was there anything, Amy, Aaron, Tim, Pete, Debbie, that you felt we didn't get out here and that are important for people to understand besides Tim's amazing last line there? Nope. Wonderful. Well, thank you all for joining us. This recording will be made available both on our Facebook page as well as on our website. We have a COVID resources website that you can find by going to our website, disabilityvoicesunited.org, and you can find it by going /CV for coronavirus. And we just hope that we're going to get through this, and the more people get vaccinated, the faster we will get back to normal. Thanks, everybody, and be safe out there. Take care. Thanks to all our presenters. Bye-bye.